Hi, my name is Kayla Castellano, and I will be talking about the treatment method most effective in repair and prevention of reinjury of the ulnar collateral ligament, or UCL for short. Just a quick introduction, the UCL assists in prevention of dislocation of the elbow, typically in overhand throwing athletes. Tearing of the UCL was thought to be a career-ending injury until 1974 when Dodgers pitcher Tommy John tore his UCL, and Dr. Frank Joe performed the first successful operation of repair. Since then, there has been many modifications to the original surgical process as well as a non-surgical method of repair. My hypothesis is that the suture augmentation method will be the most successful in repair and prevention of re-injury. The non-surgical method that I found is a series of 2 injections of platelet-rich plasma, which is thought to be better for older athletes who have less time to rehab a surgery process and can return to their sport faster. But the re-injury rate of that is higher. The first surgical process that I found is internal bracing that uses a collagen-dipped fiber tape, which over time the body will naturally heal to repair the tear. The second method that I found is the modified Jobe technique with docking method, which uses a graft, and it puts it through a series of tunnels and then secures it to a bony bridge by a suture. And this is pretty successful, but the rate of re-injury is also high. The last method that I found is the suture augmentation method, which does not use a graft and that just pulls the tear together with sutures. A little personal background, I actually suffered this injury my sophomore year of college, and I got the suture augmentation method and have since had no problems and have returned to my sport pretty rapidly with no re-injury. The results show that the suture augmentation method is the most successful with a 90% return to play rate. The rate of re-injury is very low, and a lot of athletes have no problems after they receive this surgery.